It is just a huge honor for me today to podcast interview Dr. Charles Moser, DDS. After graduating from the University of Texas Health Science Center San Antonio Dental School in 1990 and completing a general practice residency at St. Francis Hospital in Hartford, Connecticut, Dr. Moser moved back to Houston. After 16 years in private practice, in 2009 he joined South Texas Dental as the dental director for Houston and San Antonio regions. South Texas Dental, with over 40 offices, was the largest Medicaid producer in the state of Texas. Again, the philosophy was simple. The patient is the most important person in the practice. He became a certified speaker trainer and coach for the John Maxwell team, as well as an approved speaker for Densply. Very few offer the combination of perspectives that include cosmetics, private and group practice, corporate dentistry, dental service organizations, leadership, and personal growth. He believes great answers come from great questions, and we must think outside of our comfort zones to grow, and the only way that happens is with intentional. With over 25 years in dentistry, he understands how to create leaders and great clinicians. Dentistry is about relationships and trust. Treatment planning and case presentations are vital for a healthy, successful practice. Before we start, let's get a COVID-19 update for the great state of Texas.
Well, first of all, it's a pleasure to be here, Howard. I appreciate the intro. I couldn't have written it better myself. COVID-19 in Texas. So we are, I guess the easiest way to understand it would be on voluntary quarantine at this point. All dental offices are closed only to be treating emergencies through the date of April 21st.
And do you think, and what's the chance, do you think that's a hard date, or what's the chance that April, when is the date they're saying now?
Yeah, April 21st. They're saying that April 22nd is when we'll be able to open our offices again. No, I think that's a soft date. Of course, everything that I say is just my own pontification on the subject, of course. But I think that if they were to say what really probably is more likely an 8 to 12 week period, that it's going to throw people into even a bigger panic than they already are. So we'll take it a month at a time.
How many dentists do you think? I mean, let's go April, 1 month. How bad would that be? What percent of the dentists do you think in 1 month would they keep their staff? I mean, if right now you're in Texas and you're thinking, we have to be closed for 1 month, and it's, we closed down St. Patrick's Day, so let's just play with that you had to close down a month from St. Patrick's Day. How many of the dental offices would make payroll for their staff for that month versus let them go? You can't squeeze blood out of a turnip and tell them to go file unemployment.
Well, so we have this discussion a lot at the DEO and with our membership. And I think that what you're seeing is that people are falling into two different categories. There is a category of doctors out there that think that their staff and their team, I prefer to call them team, a staff is a long wooden thing that Moses used to part the Red Sea, that their teams are family members and that they're going to pay their team as long as they possibly can because that's their duty to them. I respect those people a great deal. I happen to take the philosophy that our duty to our team is to make sure they have a business to come back to. So from that standpoint, I think that some people are making the hard decision to either furlough, lay off, or fire their team such that it makes them available for unemployment. And then it's my understanding, and I'm not an accountant or a lawyer, I've just heard that it's my understanding that you can then supplement, if you choose to, you can supplement your employees' benefit that they're getting from being unemployed up to as much as they're receiving from unemployment. So I think that's probably a better business play so that you can stay in business and actually have a practice for that team to come back to in 30, 60, or 90 days.
And it's tough because if you follow, the American Dental Association has, I think, the greatest economist in all of dentistry. I mean, who knows more about this than Marco Vujicic, PhD. And the last 2009, 2011, after the Lehman's Day, he wrote the piece of Lawyers, Lattes, and Dentists showing that post-recession coming back was coming back for everything, but not dentists, lawyers, and lattes like Starbucks. Do you expect to see that again this time, proving once again that dentistry for the most part is discretionary, and that when we come out of some huge macroeconomic shock like this and lots of missed wages, that the last thing people are going to do is want to get their teeth cleaned and go get bleaching, bonding, and veneers?
Yeah, I think the short answer to that is yes, I agree with you. The long answer is that dentistry will always be needed by people. You can't do it online, which is kind of the best thing that dentistry has going, or one of the best things it has going for it. You can't do it virtually, at least not the actual restorative part of it itself. So I think knowing that people are going to have to go to the dentist ultimately, and while integration could be slow, those that plan effectively now and use this time wisely to perhaps clean up things like SOPs and work on their leadership. I do think this is a time where it takes strong leadership, work on their ability to coach their teams to be better when they come back, and to understand how serving the patient is going to change. Then those people will be positioned better than the people that don't take this time to prepare. And so, yeah, I think we're in trouble. I think this hurts big time, but we will come back from it. Dentistry will always be needed. And those that take this time to prepare to how properly to reintegrate are going to come out better on the other side.
Now, the reason they call it the great state of Texas is because 4 out of 6 of my grandchildren live in Beeville, Texas. So I'm on the phone to Beeville daily. What % of dentists in Beeville are completely shut down? And what % would you say are trying to follow protocol of being open just for emergency dental?
Yeah, so empirical data from what I know, and I guess I talk to, or at least I have access to about 160 DSOs on any given day.
Are those all in Texas?
No, that's across the country.
Okay.
But I think probably 10% of them out there right now are perhaps, they're just open. Let's just call it just open to see patients if they can get them in. I would say 35% are probably closed completely. They have just closed their doors. And then the rest of that middle group is 55 to 60% of them are probably open to take care of emergencies at this point.
So so let's do those numbers again. You think 10% are open for business, are still open for business as usual?
Yeah, just trying to, bucking the system a little bit. And again, that's just a guess, but
and then what was your next number? 30?
Yeah, I'll go the other way. So 35% have closed completely. Just doors shut. So that leaves 55% in the middle that are probably in what the CDC and the ADA would say is proper compliance and being open for emergencies only. And again, I haven't seen that written anywhere. That's just kind of from what I hear on the streets.
And do you think there's any lessons learned from Wuhan, China, and currently Italy that gives you any? You're a doctor. All these doctors of dentistry have been looking at this information. From everything you've learned and read about this, how long do you think the big outbreak would be in America, where we would have to try to flatten the curve and try to do everything we're doing now? How long do you think that's really going to be? How long would that range of time be?
I'm just getting my information just from the same place everybody else is, and that's watching TV and webinars and podcasts. I really think that we're looking at least at an 8-week closure. And then if they're going to reopen the way they've closed, then it's going to be a state to state decision as to when the governors or the health professionals per state decide that it's okay to go back to work. But again, what I'm hearing is that we're not going to see the peak of that curve, whether we flattened it or not. The peak of that curve is going to happen in the next 10 to 14 days. So if that's the case, and if you've seen Fauci's example of flattening the curve, while it does flatten it, it does elongate it as well. So I think there's a little bit of a yin and yang there. While we certainly don't want to, I think the purpose of flattening it, correct me if I'm wrong, is to not overflood our healthcare system with patients, but it could prolong the amount of time that this pandemic is around with us. So I think that people should prepare for 8 weeks. I think it would be irresponsible to not be prepared for at least 8 weeks.
And it could be 8 to 12. There's a lot of people saying,
Yeah.
I talked to dentists in Italy this morning, and they're saying that if what happens to America happens to Italy, it'll be 3 months. And then the solution was to cure it would be to kill the economy. So it looks like this coronavirus is lethal in several ways. Don't downplay your card. I mean, you're the clinical director for a lot of offices. How many offices? You're with the Dentist Entrepreneur Organization, and how many?
So that's what.
Explain what that is, and how many offices are you in touch with?
Right. So I was the dental director for South Texas Dental, and I left that organization in 2016. And for the past 2 years, I've been the vice president of community management for the Dental Entrepreneur Organization. And what we are is an organization that helps group practices scale. We help people decide and help them work through what their vision is, what their mission is, and we help them achieve that. We are somewhat in the business of helping people scale, but that's not what we profess. So if you were to join the DEO, we are certainly not going to tell you, Howard, you need to be buying more practices, you need to be building more de novos. We're here to help you identify what your vision is, and many of those visions are to grow and to scale. And perhaps even, create an exit strategy for people. So our membership is based, we have 165-ish members, and we're pretty proud that we're just at about $1 billion in revenue between those 165 members.
And so what's the business model for you? How much to become a member? So basically on your website, which is DEOdentalgroup.com. And
Correct.
DEO stands for Dentist Entrepreneur Organization. And this is not a commercial. You didn't pay for anything. But Dentist Entrepreneur Organization members are put through an initial 12-month process to get exposure to all aspects of what makes a successful dental group or DSO. Members will collaboratively walk through the best practices for building a successful multiple location group, including practice acquisition and de novos, associate retention and management, how to form and optimize a legal DSO, essential key KPIs, key performance indicators for expanding group practices, essential systems and processes, recommended vendors and software, becoming an effective CEO, expanding your leadership ability, coaching others to their maximum potential, effectively communicate in tough conversations, expanding your self-awareness and blind spots, and much more. But before we get into that, let's talk about the DSOs. It's all over Bloomberg that the market, when it expands, the Fed always gets blamed for making money too cheap. And when the federal government has $19 trillion in tax, they don't want to normalize interest rates. They don't want to pay 5% tax on $19 trillion in debt. So that's why they've always tried to keep interest rates so low, almost zero. In fact, if you go back through history, you always wanted to hold the same hand as the superpower. So when the big ones were all holding their money in gold and silver, that was your best investment. And right now, since the 20 largest countries are 40 trillion in debt. Cash has been trashed. That's why people are forced to throw it in the market. But when the market starts contracting, a lot of these groups are their debt service is too high. How many DSOs or group practices with multiple locations do you think are extremely leveraged and would be vulnerable during an economic contraction?
So how many of the DSOs are extremely leveraged? Wow, that's a really tough one, Howard. I can't tell you how many. I can tell you that there are some, for sure. My question back to you, though, would be how many private practice dentists are there out there that are in the same situation?
At least a third. At least a third.
Yeah.
I mean, they just come out of school with $400,000 in student loans. They might have paid that down to $300,000. Then 5 years out, bought a practice. Average practice price $750,000. They're routinely $1 million in debt, and they are panicking right now. And that's why I wanted to get an older person on like yourself, since I'm too young to have experienced any of this. I wanted to get someone. No, I'm just kidding. But so
can your viewers see our pictures here?
My gosh. So a third of the general dentists are in trial. And by the way, that is a shame that I feel sorry for the big DSOs is, when you got 500 to 1,000 offices, you live in an aquarium and everybody's always pointing and talking to them. Individual dentists are opaque. If the media covered the individual dentists as closely as they covered DSOs, it would be crazy. But yeah, I think one third of the general private practice are financial leverage. And when you talk about staff turnover, you hear all these stories about how they hated working for a DSO, blah, 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 blah. Well, the private practice doctors can't keep their associates either. The staff turnover, hell, the FANG stocks, Facebook, Apple, Amazon, Netflix, Google, which is now Alphabet, their average millennial only stays between 1 and 2 years. I mean, they can be throwing every perk at you possible working at Google, and then you go get a latte at Starbucks and someone says, hey, why don't you come over to Uber and learn how to do driverless cars? And they're like, well, that sounds fun. I've been doing the same thing over and over every day for a year. I mean, they just jump jobs like that. So yeah, DSOs have transparency, but yeah, I'm totally aware that 1/3 of the dentists are over leveraged. Most private practicing dentists can't keep an associate, turnover. But
well, I want to jump in here and I want to make a distinction between what a DSO is to begin with. DSO has such a bad connotation to it. I'll use the term corporate dentistry. DSO really is nothing more than a dental support organization. And that can be for a dentist who owns 2 or 3 or 4 practices completely on his own. And you may not even know that that is a DSO. So I think that if we're going to talk properly, then if we want to talk about corporate dentistry, we're going to talk about the ones that have the name brand associated with it that people on your listeners might understand. There are DSOs out there that own thousands of practices that patients have no clue because it says Howard Farran on the door, but the patient doesn't know that Howard Farran has a support organization that is supplying some of the non-dental resources to you to help you be able to run your business more efficiently and effectively. So there's a lot of bashing that goes on with DSOs and corporate dentistry. And I guess the only thing that I would really like to say to that is that people need to understand that there's been bad dentistry and unethical dentists since the very first dental graduating class. So does a DSO promote bad dentistry? I don't know. I mean, I don't have any clue. When I worked for the DSO that I worked for, they were the most ethical business that I've ever been a part of. And I can say that hands down.
Which one? Are you talking about the Texas one?
Yeah, South Texas Dental.
South Texas Dental. And are you saying DSO? what is the most normal? Is it dental services or dental support organization? What is the de facto?
I think it's dental support organization is probably the de facto, but I think that's kind of one and the same. It's just a matter of creating an entity above a couple of practices that help supply the human resources side, the accounting side, the legal side, the collection side, all those things that you can actually scale over several different dental practices. And so while some people think it's the devil, when I was in private practice for myself, I had an accountant, I had a lawyer, I paid somebody to do advertising, I had human resources that I had to take care of. And I don't understand why it becomes the devil if I choose to just consolidate that into an organization that is above multiple dental practices, that I can scale that to multiple dental practices. So to me, that doesn't seem to be the devil. Now, I completely understand if the devil is telling you what type of dentistry to do. I certainly do not advocate a non-dental entity telling dentists how they should be diagnosing, treatment planning, and performing dentistry. That is absolutely, completely against everything that I believe. And as a matter of fact, the reason I got into the DEO itself, the reason I joined that organization was because if I had the opportunity to, in any way, shape, or form, make sure that these groups knew that quality dental care and treating patients with respect and integrity was the way to do it, and if I could impact that, I wanted to be a part of it. And so that is exactly why I joined the DEO. So I hope that answers your question a little bit.
Yeah, and these DSOs. I mean, there's a lot of them. Do you what are their plans? Are they in Arizona? A lot of the dentists, the private dentists, have had to let their staff go and tell them to file unemployment. And what most dentists are doing is sending them the link of here to file for unemployment. In fact, some states, their unemployment has crashed, and there's a Federal Reserve chairman who thinks that by the end of March, unemployment is going to be 30%. You got to remember, in the Great Depression, it was 25%. Do you see that on the DSOs, or cash is king? I mean, you can't make payroll if you don't have patient flow equals cash flow. Is that what you're seeing?
Yeah, I think it's the right play for the most part, in that these DSOs are recommending to their employees that they go ahead and file for unemployment. I believe it's even possible. Again, I would tell your listeners to make sure you check with your accountants and your lawyers and your advisors. You can give people partial unemployment if you want to keep a skeleton crew available, and you can still employ them part-time. But I think the good news is that even though we talked about this possibly being 8 weeks, 12 weeks, maybe even 14 weeks, that is still, in the overall scope of things, a relatively short time to be on unemployment. And then hopefully we can get these offices ramped up again and everybody can get their jobs back. I understand that's, you can't hang your hat on hope sometimes, but we might as well try at this point. I mean, I'm really going to go out on a limb here and say that people are not going to be unemployed for a year or 2 years at a time right now. So let's hope that this is a short-term issue.
And so let's talk about what you're doing. So that was started by Jacob Pohl, the dentist entrepreneur organization, DEO. Is that correct?
So well, not quite. Actually, it was started by a periodontist whose name is Mark Cooper.
Oh, yeah, I love Mark.
Yeah, so Mark had a group called the Mastery Group. And from the Mastery Group, the DEO evolved. Jake Poole was brought on to be the CEO of the Mastery Group, which quickly morphed into the DEO. And then perhaps about a year ago or so, Jake went ahead and acquired the practice, and Mark is now off doing things that he loves to do.
It was he retired, didn't he, Mark Cooper?
I think he's doing a wisdom council now these days, which is perfect for Mark Cooper, right?
Yeah, he's
Yeah.
God, I'm trying to think of what I used to know him. The first 10 years I knew him, he had a nickname. I think it was the Swami, wasn't it?
Well, the one I knew him of is he was the dental Yoda.
Yeah.
Yeah.
Mark Cooper, Cooper.
Yep.
Yeah. I'm trying to think of what program he was on, but yeah, that was a how long has Jacob had it?
I think Jake's been the CEO for about 2.5, almost 3 years, maybe.
That's why I have the hard time finding Mark Cooper. It's not MARK, it's MARC.
It's MARC, right?
My gosh,
correct.
you creative mothers out there who want to give your kids unique names. Oh my God! In fact, in California, if you look up the name Unique, it's spelled 276 different ways. So Mark Cooper sold the Mastery Company to Jacob. How long ago?
I think that's 2.5 years ago.
2.5 years ago. And is he and how was that? Is he glad he did that? How was that decision?
Oh, I think it was a business decision. I think that Mark had taken the company in a great direction, and Jake had another vision for it that has worked out quite well, and the company has tripled in size, I think, in the last 2 years. So things are going quite well. I think Mark Cooper would be very, very proud of what's gone on.
And so, what is going on? What is How is your business? Is it growing? Is it flat? Is it contracting? How is the interest in wanting to grow your own DSO? What percent of dentists want to be Rick Workman? Where when they grow up, they want to be a Rick Workman. How many? How prevalent is that?
Well, I think a lot of them want to be Rick Workman until they see how hard Rick Workman actually works. There's this thought that Rick Workman just sits in a big palace and waves a magic wand and makes Heartland Dental Group go. But I know that Rick Workman works very, very hard. The people that come to join the DEO, I think one of the things that really has been very comforting to me is that almost to a member, they are still, number one, concerned about patient care. They also have this entrepreneurial drive in them that makes them want to do just a little bit more. They have this entrepreneurial spirit that just drives them to a different end point than really what I did when I was in private practice, and that was just a solo practitioner. So these are a unique group of men and women that have this drive to form something perhaps even a little bit bigger than them. They have different reasons. Some of them are looking to create a legacy business for perhaps other members in their family that may want to go into the dental field. Some of them view it as a business that they can grow and then exit, and ride off into the sunset. And some view it as a breeding ground, actually. They're bringing in other dentists. They're training them to do things. I do think that our dental schools, even at 4 years, in today's day and age, cannot do a sufficient job in training young men and women to get out there and be the clinicians that the public expects them to be. I don't know how you felt your first day of practicing after dental school, but I was as nervous as a 17-year-old bride, So I
have not heard that one. I've never heard that one in my life.
Well, there you go. So yeah, I think the DSOs have a really nice opportunity to take these young graduates underneath their wings and create an extended period of learning for them. Look, some of my mentors don't understand it. They don't agree with it. They don't appreciate it. But the reality of it is...
And what areas do they not agree with or not appreciate?
So...
This is Dentistry Uncensored. Let's get to the crux of it.
Yeah, I think it's interesting. They don't perhaps appreciate the fact that these young men and women look at dentistry as a business. It's, I was told, Charles, it's healthcare. And I was like, I think the two are mutually exclusive, or perhaps exactly one and the same. But we have this huge problem of dental graduates not having a place to go after they graduate. And as I said to one of my mentors, how many associates have you had since you've been in business? And the answer can be answered on one hand. So if the private practitioner doesn't have the capability, even if they want to hire and employ these young graduates, like you said, with $500,000 of debt, where are they going to go?
Yeah, there's a lot of things that they don't, it's so easy to bash DSOs because all through time, everybody hates competition. I mean, nobody wants to have to work harder, longer hours for less money. I mean, if dentists had it their way, they would go in Monday morning, they do one crown, Delta would pay them $1 million in cash, and then they'd go home for 3 months. And that's really what they believe. And then in Arizona, it's even worse because the board is made up of all these amazingly good people. I know them. They're good quality people. And they're always chasing out the foreign dentists from Mexico who are practicing on Mexicans who are not citizens, who don't know a word of English, could never afford to go to my dental office. And they always do it. They send over the police. So basically they see a trained dentist in Mexico helping someone who's in pain. And what's their best idea? To send the police to kidnap him, put him in a cage, and then on Sunday they always have time to go to church. And it's like, I'm really I've lost my faith in the entire licensing committee, because I think the whole state boards of medical and dental examiners are exactly a legal tool that the physicians and dentists use to hold up their wages. I mean, you can't go buy penicillin unless you go stand in line at your doctor and you get your government paperwork in order. And they're always talking about healthcare cost containment. Well, one of the ways you get rid of healthcare cost containment is deregulated. I mean, could you imagine what would happen to the price of prescription drugs if the government just said, oh yeah, Amazon, Jeff Bezos, you can sell any prescription from anyone to anywhere you want to go. And then when you look at the research implications of it, I mean, right now, if you got a great idea for a drug, you got to spend millions of dollars and do it on mice, and monkeys for 5 years. Then when you're done, they'll say, well, it's still not a human. Then again, the government's shaking you down for an FDA approval, license, and all this. So it takes 5 to 10 years. Meanwhile, your kid's sitting in a wheelchair dying, whereas if it was completely unregulated, people would say, hey, I've reached a point where I'll be your guinea pig. Let me try it. So yeah, I don't have any, I've been losing a lot of faith in how people view dentistry. I think money's the answer. What's the question? And it's amazing how much, if you have a financial incentive reason to believe A, you'll believe it. And if all the science and facts says believe B, they won't believe it. Like, for instance, what you just said, the dentists work Monday through Thursday, 8 to 5, 32 hours a week on a 168-hour a week. They're not even open 20%. They're open 19% of the week. And then you look at the publicly traded dental offices, there's only 3 publicly traded. They're all open 7 to 7, 7 days a week. We're talking 1-300 Smiles and Pacific Smiles in Australia and Q&M in Singapore. A lot of them take Medicaid or Medicare, so these dentists badmouth DSOs, but they don't take any Medicaid or Medicare, and a lot of these DSOs take them all. Look at Bob Fontana. I lost my own uncle to him. Because I had to, if you came in, I had to take an impression and send it to the lab, and he has a lab man in office just like they used to when I was in high school, but I don't have a lab man in my office. I can't do 1-hour relines and things like that. It's a better service. But humans don't like competition. They'll justify anything if it'll make them a buck or give them more power, entitlement, or whatever. But I think Bob Fontana, the way that he has, with a mission gone, he says, I go where the dentist ain't, and we have a denture lab man on premise, and he goes to all the poor areas. He takes Medicaid. He does 1-hour denture relines. I mean, he's serving the people. So I don't buy into the dentist whining about competition. It's just not valid.
Yeah, I think that and look, I that 32-hour week that you just designed earlier, I'm all for it. Just the reality of it is that's not the way it is anymore. And in my view, the way it occurs for me is that dentistry really is a commodity, and commodities need to be available to the public when the public wants to purchase them. And the people that I see under the age of 40, and maybe even under the age of 45, that are being very successful now in dentistry are doing it because they're thinking outside the box. They are open when the consumer can come to them. They're not open and saying, consumer, you have to come to me when I'm open because I'm that important. People that are open after hours, people that are open on weekends, they're the ones that are attracting the new patients. Now, again, it takes time, and there are a lot of again, my mentors would say, well, those aren't the patients that I want. I understand that statement. I understand what you're saying to me, but I just, look, I met LD Pankey. I love the man, but I think things have changed since LD Pankey practiced dentistry.
And I think what's changed the most about LD Pankey is the story told about him. I mean, your life is going to be determined by whoever writes about you when you're gone and after you die. And you die the second time when your name is never mentioned again. But if you listen to people in Kentucky that knew LD Pankey, where he was from in Kentucky, they always forget the story that there were 4 dentists there. One would do the extractions and the low cost and then upgrade to be more quadrant dentistry. Then the next guy could do more complex. And he was the bottom of the funnel doing the full mouth rehab at the bottom. And then when you go through 6 weeks of the Pankey Institute, they don't talk anything about the first 3 guys that worked in that office. They just talk about the bottom of the funnel. And I've gone there. I went through all 6 weeks of that stuff, and it was great to learn. It was rock solid information. I'm so glad I went to Pankey and all the places I've gone over the years to learn how to make a Mercedes-Benz, but there's a hell of a lot more Chevys and Ford pickup trucks sold in Texas than Mercedes-Benz. I mean, Eric's out in Beeville, and I think an F-150 is bragging rights in Beeville, not a Beamer or a Benz. And that's how LD Pankey got rich enough in Kentucky to move down and to retire in Key Biscayne, is by having a big group practice that sold a Chevy, a Pontiac, and Olds. Do you agree with that assessment of Pankey or not?
I do, and I think that he understood that people want to buy different things, but he wanted to provide one thing, and so he provided what he wanted to do. And I'm not going to say it was easy when he did it. I will say it was easier. We didn't have a dentist on every corner. We didn't have social media. Obviously, we didn't have a lot of things. And do I wish we could turn back the clock? Maybe. I don't know. But that's not for me to decide. These are the conditions under which we have to work now. Again, my number one why in this world is making sure that people get quality dental care. And that's defined by the best dental care that you can do with your 2 hands. That's different dental care than what I can do with my 2 hands. But let's do it with integrity, and let's do it with compassion, and let's care for people. And I want to add one thing, and that no dentistry is inferior to some dentistry. They're always worried that in the Guadalupe Indian Reservation, there's some Mexican dentist that's not licensed in America up here doing a filling on some girl that doesn't, has a minimum wage job, that her getting no treatment, which is what would happen as soon as they arrest the guy and run him out of the country or put him in jail. Because God knows, when you read the Bible, the most clear thing you'll learn is that if you see someone treating the poor, he should be arrested, thrown in a cage, and ran off. I mean, I don't know where, but they believe that is superior
to any treatment by someone less regulated. And then they walk around the country. The reason no one has any faith in the government is they walk around the country saying, well, we want to fix healthcare. We want to make it affordable. It should be available to all. Dude, the only reason it's not is because what you've done to it for the last 75 years. I mean, it's like they come up to you at the government and take a baseball bat and break your arms and legs and knees and then tell you that they're going to offer you a free wheelchair.
I think for me, the biggest disappointment is how much it costs to deliver dental care. You know, we've already talked about the $500,000 in debt, and I do think that the one effect that coronavirus COVID-19 will have on dentistry is that we're going to see our OSHA compliance skyrocket. We're going to see the PPE that we're required to wear, I do believe, is going to increase. The way we're going to have to turn over a room is going to take more time and require more resources. So I do think that the price of delivering dentistry is going to go up. My big problem is dental insurance and reimbursement rates. As the cost of dentistry goes up, reimbursement rates either try to go down or they get harder to collect, or there's more small print, there's more reading between the lines. And it's, as I tell people, what you have is not dental insurance at all. All you have is a prepaid financial plan. Insurance is something that's there for catastrophic events, and a pro fee will almost never be a catastrophic event. All you have is financial aid, and that's a real travesty. I wish there was some way, you know, we could really make some headway in how much money people get annually for their dental insurance, and really making it much easier for them to use it and making it easier for the provider to collect it.
But even that is just something you want to believe in. I mean, people believe in philosophies, religions. I mean, my two older sisters are nuns. I mean, it's amazing what they can think of. But, you know, the smartphone came out. It's $1,000. Nobody helps you buy that. Every time I go to Beeville, Texas, I mean, you go to Walmart, everybody has an F-150 or an F-250 or an F-350, and those are about $50,000, $70,000, and $90,000. They have no problem buying that. They have no problem buying a house. And then the dentist and the doctors just think that when you have a pimple and you go to the dermatologist, that now it's your employer's or your government's fault. And so it's just this belief system that's grounded on nothing other than wishful thinking.
Yeah, it's a bit of a values issue for sure. I won't argue with you there. So if we could just get rid of dental insurance altogether, I'd vote for that. That would be a big reset button.
Yeah. So when people are joining your program, first of all, how much is a program? I see you have a DEO online workshop for 8 weeks, and then you have a membership 12 months. What are most people signing up for and joining?
Yeah, so that's correct. We have a program that's called What's Next, and that is a program that I lead, and it takes people through an 8-week process with four coaching calls as a group, and you're given certain modules to watch. And it takes you through what is dentistry now, where do you think dentistry is going? It takes you through some leadership steps. It takes you through how do we prioritize what's important? How do we really decide what we're going to work on? It talks about certain vernaculum in the group space. Not a lot of people really understand perhaps what EBITDA is. If you only have one practice, why would you know that? And so that's an introductory program that I believe runs somewhere between $2,500 and $3,000. And then our membership actually, I believe, runs approximately, and don't quote me 100%, but it's about $15,000 a year, and that's a monthly subscription fee. I'm not in the sales department, so I think those numbers are fairly accurate. But that's a 1-year program that puts you in connection with like-minded dentists. That gives you an amazing resource, and on our portal we have just terrific resources. All of our events are videoed and recorded, so they're all kept in the library. You have access to one-on-one coaching. Our live events are pretty much world-renowned at this point. Our industry-wide events, which are called summits, we do 2 of those a year. We actually had Gordon Christensen as a keynote speaker. We've had Rick Workman as a keynote speaker. They're just fabulous events, and they're great networking opportunities to come and meet people who have the same issues and challenges that you might. And we just believe that learning through a community is a really good way to do it. I'm not going to say it's the only way to do it. And then kind of our triad is that we believe that you need to grow yourself, you need to grow your team, and then you need to grow your organization. And that's somewhat of our model.
Okay, let's talk about your leadership. Let's start with Jacob Pohl. As the CEO of the Dentist Entrepreneur Organization, Jake is dedicated to providing group practice leaders the resources and support they need to think like a CEO. How's Jacob? What do you think of Jacob, and how's he doing in all this?
Jake is a visionary. I mean, he moves fast. You need to move fast with him. He is listening to suggestions from our leadership team. Right now, our leadership team, and I sit on the leadership team, we meet twice a day right now to make sure that we are delivering the content, the information, the resources to our membership to make it valuable. I've spoken to 50 of our members in the past week, and what they're telling me is that if they were not a member of the DEO, they would be turning towards individual Facebook posts. They'd be turning towards individual podcasts to try to get information. We can now bring 60, 70 people together on a call at one time, and we can really utilize those 60 people to bring information from so many different areas that you just can't do it all by yourself. Now, dentistry was such a, we lived on an island for so long, dentists, we were just the odd man out. And now we had this just enormous community of resources that we can provide to people.
Well, when I first met Jacob Pohl, it was on Dentistry Uncensored back in 2015 when he still worked at Fire Gang. And,
okay.
And it was a real popular on YouTube. Hell, it had 1,500 views just on YouTube. So, I mean, he was with Fire Gang for 6 years. So does he bring a lot of Fire Gang marketing expertise to the Dentist Entrepreneur Organization? And where on a successful rollout of a DSO would you put marketing as opposed to a good location?
So I'm not exactly sure about your question about Fire Gang. I mean, Jacob doesn't talk marketing at all with our membership.
No, I just meant he had a 6-year background in dental marketing when he was with Fire Gang. He was with Fire Gang Dental Marketing for 6 years, and he was with Fire Gang when I did a podcast with him. So I know he's well-versed in marketing. And my question was, for a successful rollout of your second or third or fourth location, would you rather go in and get an A location and not have to do so much marketing, or is a crowded, busy location okay if you have a silver bullet of A+ marketing in your pocket?
Yeah, so again, I would say that that's probably a personal choice. I sold real estate for several years at one point in time in my life, so I kind of still believe location. Again, my personal opinion, get a great location, pay for it, and assume that a third of that rent is kind of working as a working in your marketing bucket as well. Because if you have a great location and great signage, then that is marketing. So again, I think that's one of the big changes that dentistry has made as a profession, is that we have chosen over the past 20 years to be much more visible to the public, rather than in a professional building somewhere tucked away. But I really think it depends on the individual and your individual model, and what type of patient you're trying to see, what type of employee you're trying to attract. I'm sorry. I know that probably doesn't answer the question as clearly as you wanted it. But
well, let's go to that. Why, coming out of dental school, What percent of the class so we're going to have in 2020, we're going to have a class graduating in 2 months. I still don't know how the dental schools are going to do that. They're closed for business and got to graduate 6,000 kids in 2 months.
Right.
This is such strange times. But let's say you eventually get out. You're 6,000 kids, you get out. How many of them expect to get a job at a DSO?
88% of them is, I believe, the national average.
Yeah, and so all the dentists that are complaining about DSOs, you're not going to give them jobs. When I got out of school, the only person that would give you a job was the Army, Navy, Air Force, Marines. In fact, the Marines would. They don't even have dentists. The Marine dentist is through the Navy. So it was just Army, Navy. There's public health, Indian Public Health Service. So I applaud the DSOs so much for giving my homies our replacements a job till they get on their feet. Now, once they get a job for a DSO, how long do they stay at a DSO before they job hop and go to another DSO, another office? I mean, what would you say the turnover rate is?
Yeah, so I can speak to that based on my experience, my 8 years that I spent with South Texas Dental. If I could get an associate to last a year, then I pretty much had them for 3 years. And that was kind of the next benchmark, if you will, was at the 3-year mark. I would say, it was kind of split down the middle, 50-50, 40-60, that they would actually go looking to do something else, not necessarily go to another DSO, but it was probably time for them to try something on their own. We didn't have a whole lot of people DSO hopping, and I don't see that really now. I see very, very little of that now. What I see is at that 3 to 4 year mark is people deciding, do I want to do this on my own, or do I want to make being an associate, or nowadays, perhaps even the opportunity of being an equity owner, having some sort of equity stake in a DSO. It certainly isn't going to be equivalent to the owner's equity position, but taking some sort of equity position in that current DSO that you're with, and then making that your career.
And you think, what percent do you think will want to make that a career as an employee? What percent of this? I mean, what percent of people go to college for 8 years, become a doctor, a dentist, a physician, a lawyer, and then say, I just want a job. I don't want to wear all those hats. I don't want to, it's too much. How many would you say that is?
So I need to be clear here. What I'm saying, I'm going to say in the most positive way possible. I think this is a good thing for dentistry. Dental school classes have changed dramatically over the last 15 years, men to women, right? So now what percentage of women are in a dental school class now, would you say?
50-50.
Yeah, I would say across the United States, that's probably accurate. Here in Houston, it might be a little bit higher. Women, as far as I know, as a scientist, are still the only gender that can have children. Until they change that, then I think what you will see is that women will want to work DSO. They will, in the masses, the overwhelming majority will want to stay an employee because it's a fabulous way to have a career and still raise a family. And again, I say that very positively. This is not a knock at all on women's ability to be in leadership positions. As a matter of fact, I think they should be in leadership positions. I think they're equipped to lead. I just think that until men can start having babies, that women are going to be the ones that are going to be creating families. And dentistry makes it very comfortable for them to have a fabulous career. They're tremendous clinicians, and they can go raise a family and then come back 6 weeks, 8 weeks, 12 weeks after FMLA and resume their career. It's very difficult to do that. If you owned a solo private practice, you're almost forcing women to make a decision. Do I want to have a career or do I want to raise a family? So in that regard, following that line of thinking, and again, I want to say it over and over again, this is in a positive way. This is not meant at all to create any sort of sexism at all. It is merely saying that if we're now graduating 50% of dental school classes that are women, we're going to see a higher percentage of our graduates choose DSOs and choose a career where they're not sole owners. I hope I made that really clear on how I was trying to put that there.
Yeah, this is challenging times. I mean, I can't believe this is March 23rd, and in 2 months, there's 6,300 dental students in America thought they were going to graduate as a dentist, and now they're at home. And the dental schools, like Texas A&M, is trying to move everything they can to online. Have you heard anything from the three dental schools in Texas?
No, I haven't, but I mean, I have a senior in college right now, and he's been moved to online. Everything, all the education has been moved to online, I guess, somewhat indefinitely. Curious, how do you take the state board online?
Yeah.
I mean, I can see finishing dental school somehow, some way, maybe, but how do you take the state board,
Yeah, and so do you think the other factor that's helping? Whenever there's a change in demographics, something's going to change. And as dentistry went from 90% men to 50% men, that's a major change in demographics. A lot of people have pointed out to me very good data showing that 2 out of 3 dentists who work in the DSOs are female indeed. I have females and friends of mine in Arizona that love it. They're single parents with kids, and they just want to do the 8 to 5 thing, and they don't want to wear all the hats because they want to be a good parent, all that kind of stuff. But do you think another driving force for the macroeconomics of DSOs going forward is the dental school tuition, which is now $100,000 a year? And I know that a lot of people like to quote the Dental School Association by saying that the average graduate has 284, but they're intentionally misleading by leaving out the fact that 20% of the dental students, dad paid for everything. So you can't factor in 20% having zero debt to your average number. The average number of people actually had to take out student loans for undergrad and that. They're coming out $400,000 in debt. Do you think that's a driving long-term macroeconomic effect of driving dentists to be employees instead of business owners?
I think it's probably the biggest reason. I think it's the number one reason. So like you said, you're graduating close to $500,000 in debt. It takes $500,000 to open a 4 or 5 op office. So now you're $1 million in debt and you haven't even cut your first crown yet. I know that banks they love to lend to dentists, but they also do it with a co-signer on it, So, I think that's the number one reason.
So we both agree the macro DSO drivers are student loan debt. Would you put the other one more females in the workforce, or would you not touch that one with a 10-foot pole?
No, I mean, again, I'm not. Again, this is nothing against women at all. I do believe it's a driver. Is it the biggest one? No, but I do believe it's a driver.
Demographics with more female students, and then of course in healthcare. Most economists, the healthcare started consolidating long before the dentist did. It was with equipment purchases. I can't buy an MRI for each doctor. I can't buy an ultrasound machine. It was the healthcare equipment was driving that. So student loan debt, a change in demographics to more women, to more female dentists, and then would you put technology next?
Yeah, I think I would, and maybe in a different way, I would put it as, it's business scale. It's the ability to, it's the economy of scales is the phrase for that, right? So if I can utilize one accountant and one lawyer to handle 3 or 4 locations and not cost me 3 or 4 times the amount as it would to cover one location, then I can start to use the economy of scales with all of my non-dental services. When I saw what South Texas Dental was paying for dental supplies, because we had 50 locations, as compared to what I was paying for dental supplies when I had one location, I thought to myself, this is completely backwards. I should be paying less amount because my overhead's so high. They should be paying more because their profit margin is so much bigger. But that's not the way business works, right? So I think the economy of scales is a huge factor in why people want to have a group. Whether that's 5 practices or 50 practices, it's still valid.
And do you think the DSOs, where they fit on the affordability? Do you think the average DSO is the same fee schedule as the normal, the regular dentist, or do you think it's they're more low cost? Because it seems like the winner of every space is always the cost leader. Southwest Airlines got 27% of the market. IKEA dominates global furniture. Walmart, Costco, Warren Buffett just bought $500 million more stock in Kroger. The low-cost provider always wins. But when you hang out with dentists for 32 years, they don't even like the low-cost provider. I mean, you go to a dental study club, it's always bragging rights about how good they are. The first guy will stand up and say, I just want everybody to know that I trim my own dies. And then the next guy stands up and says, go to hell. I pour my own stone and trim my own dies and wax my own castings. and if you can stand up and show that you quarried your own stone, poured your own dye, trimmed your own dye, raised your own bees to have beeswax, and it took you 40 days and 40 nights to make a crown, I swear to God, they'll name the dental school after you. So do you agree? I mean, no one goes to Pankey Institute because they want to be the Southwest Airlines. I remember one time I was lecturing for the AACD in Puerto Rico, and some dentist ran over to me and says, Bill Dickerson's in the next room, and he just made fun of you. He said that if you don't listen to him, then you can be a Walmart dentist like Howard Farran. And I'm like, well, shit, Sam Walton's the richest guy in the world. In fact, now that he's dead, his wife Helen's dead. One of his, I think his 4 children are worth 40% of America. If the biggest insult you have on me is that I'm the Sam Walton of dentistry, bring it on. That would be great. But do you see any DSO focus on trying to be the low-cost provider in the area, like a Southwest, IKEA, Costco, Walmart?
Well, first of all, Bill Dickerson was one of my instructors, and I love him dearly. And I can hear him saying that about you. Absolutely. And
I love Wild Bill Dickerson too.
He's awesome.
I mean, you can't. I mean, if you expect everybody to agree with every thought, hell, my 2 oldest sisters are nuns. You think I agree with all their thoughts? I don't even think they think Lutherans will make it into heaven. I mean, you got to be like my mom still thinks the America lost its glory when they started saying mass in Latin to English. That was just. That was the turning point. Yeah, that was you can't go forward speaking the native tongue. But do you see
everybody wants to go to heaven, but nobody wants to die to get there, right? You know.
So do you think any DSOs want to be the Southwest Airlines of dentistry?
Sure, I do. I also think there's several DSOs that I can think of off the top of my head that want to be the Rolls-Royce of dentistry. That's the beauty of it. And I think that that's what is the misconception about DSOs is that they get lumped into one category, corporate dentistry, which means greed, which means bad dentistry, and nothing could be further from the truth. I was on a website. I am on a website just recently. It's called Coronavirus in Dentistry. I don't know if you've been trolling that site. But there was a gentleman on there who was bad-mouthing DSOs and talking about how they were only in it for greed because they were open during times when everybody should be closing. And I just happened to look at this gentleman's profile, and one of his Facebook friends, is a member of the DEO that I know very well, who has multiple locations and is a fantastic clinician and a fantastic entrepreneur. So I was like, people don't even know really, or they don't know how broad the term DSO is.
So let's just talk about how I look at it. So here's the way I look at it. It should have been group practice. So when I see this, a lot of dentists decide they want to do another practice now, and I think it works well. But going from one practice to two would exactly be like Heartland going from 1,000 to 2,000 overnight. So that is the hardest challenge, and that is the hardest wall. And then, but a lot of them, but the highest mortality rate is when they go from 2 to 3, because if you're a hardcore producer and you can skip lunch and breakfast and close the cases and it's all you, and you have another location, you can kind of muscle both. But by the time you get to the third location, you realize what is all you and what is all your team. And then because when I'm Superman in my own office, that big problem there, oh, it's a Doberman pincher. Shut up. He barks all the time. Don't pay attention to him. And then at the second office, that Doberman's getting bigger. And by the third office, it looks like Godzilla and takes you under. And I have noticed, and so has Greg Stanley, that the sweet spot of bankruptcy in dentistry is between 3 and 4 million, because that's when you found out what you started the show with. Your SOPs aren't in order. Your standard operating procedures, your systems aren't there. So do you agree with that rant or not really?
Yeah, no, I do agree with that rant. And I think the thing that makes it so significant is that dentists, and I had this conversation today and I had it yesterday as well, that these super GPs, these fantastic clinicians out there, are trying to clone themselves in order to create more offices. And I have told people, if you could clone yourself, why would you work for you? You know, if you would clone yourself, you would go out and do it yourself. So I think that if you are that super GP, that guy that is just, if you're that Bill Dickerson, and you want to have multiple locations, my advice, which is worth the paper that it's printed on, is to think about a model where you hire associates and you allow them to do what they do well, and then you bring everything else to you, to super doc. But don't try to make 3 or 4 other super docs. Let them do what they do well, which might be just basic restorative dentistry, and then give them a system which they can evaluate patients to determine whether that patient fits their sweet spot or whether that patient should be referred to Bill. And then Bill does all the super GP dentistry. I think that is one of the biggest problems that dentists have, is that everybody has to have 6 points of occlusion on every tooth. Everybody's got to have, perfect occlusion. Everybody's got to have an amazing curve of Spee and curve of Wilson. And if you think that way, then you should be treating all those people. But maybe not everybody does have to have that. Maybe some people need a couple of fillings, a cleaning, and maybe a crown, and they can be handled by someone who graduated with good grades from dental school, but didn't decide to be this perio-pros genius like Bill Dickerson is. So that's my answer to that. Does that make sense?
It does. So I can't believe we went over an hour. I'm trying to see if there's anything. So the website to go to is DEO Dental Group, and it's Dentist Entrepreneur Organization. And we didn't talk about Darren Akapan.
Darren Akapan. He's our sales VP. Yeah.
Yeah. Tell us about Darren.
Oh God, Darren. I mean, so I refer to him as Prince Darren. Darren is the most well-connected person in the dental space that is not a dentist. And he may be more well-connected than any other dentist that I know, other than the guy from 1-800-Dentists.
Fred Joyle.
Yeah, that's him. So yeah, Darren's amazing. Again, I think that I would like to put out there that the DEO's core values include integrity, courage, and character. And I think that we exemplify those core values. We try to every day. And certainly Darren fits that bill, as does Jake and the rest of our team in operations, sales, and support.
All right. And on that note, is there any final words for COVID-19 and the great state of Texas?
Yeah, I mean, I guess I would just say that, at some point in time, Well, okay, here's what I'll say. I think the first benchmark that we should be looking for is the day that we have fewer positive tests than the day before. I think that's a huge benchmark. And if I was, telling your listeners something to really look for, that would be the day that I would start rallying my troops and say it is time to really get down to brass tacks, define what our culture is, and start looking to come back and reintegrate into the business world. And if the people that do that are going to be well positioned to take advantage of the unemployment rate, there's going to be some great talent out there looking for jobs, and there will be patients out there that want to get back in. And so that's my advice to anybody is look for that day as the benchmark. And then just globally, we will get through this. We will survive. Don't jump out of a window. Banks are making concessions. Vendors are making concessions. Credit card companies are making concessions. And, so yeah, is it going to cost us some money? Sure.
You graduated in 1990.
That
was 30 years ago.
Oh, thanks again.
What advice would you use for this gift of time? A lot of people, they focus on the negativity of their office closed down, their bills not being paid, blah, blah, blah. But there's a gift of time. What would you do? I mean, there's worse things to happen than you get a month off to stay at home and just eat until all your food's gone. What would you recommend young kids, say it was 1990 and you just walked out of school. What would 30 years later you tell that 1990 dental graduate to do with this gift of time?
Yeah, so that's a great question, and thank you for asking that. So first of all, you need to spend some time really honing in on your mission, vision, and value. That's step number one. Define who you are and what you're about. Simon Sinek, start with why. Everybody that's got a good why seems to come out of things just fine. Then you want to sit down and you want to just put everything into a bucket. You want to look at your standard operating procedures. You want to look at your procedures for interviewing and hiring people because there's going to be that opportunity out there. You want to take some time to read and hone your leadership skills. You want to learn how to coach employees so that you can hire a B- employee and turn them into an A+ employee. Be a genius maker. You don't have to be the genius yourself all the time. Take some time to work on training and onboarding and expectations. Learn how to prioritize. Those are the things, that when I talk to people that are always saying, well, I'm so busy working in my practice, I have no time to work on my practice. So those are the things that you can do now to take advantage of the time that you have. Look for that peak and that spike in when it's time to start reintegrating. Stay in communication with your team. Get on the phone. Create Zoom calls with your team. Make sure that you're touching them at least twice a week. Keep them in the know of what's going on. And be ready to come out of this, and hit the ground running.
Well, the next time I go to Beeville, will you show me where the best drinking spots are around Beeville?
Just give me a call, buddy.
All right.
I've ridden my bike through Beeville many, many times.
Have you really? How far away? How far away is that from you?
Beeville is well, let's see. We ride the MS 150 from Houston to Austin every year. And Beeville is it's about 65 miles from Houston.
Man, I'm seriously, every time I go there, I was saying this is the last time I'm going to visit. I'm just going to move here. I mean,
I could be wrong. Sometimes I get Beeville and Belleville mixed up. Texas is so crazy, but
I was born and raised in Kansas, and then I moved out here to Phoenix, and cops are always knocking on my door. Your boy's riding a go-kart down the street, and I'm like, dude, we're from Kansas. We shoot rifles at rabbits, and they were always getting in trouble for what's standard operating procedure where I grew up in Kansas. What I love about Beeville, you pretty much live like you're growing up in Kansas. And I like my grandkids, they all have a chicken coop. If I put a chicken coop in my backyard, the government would send somebody out to arrest me and kidnap me and put me in jail. But now as we run out of food. So I don't know. I like Texas better.
Well, everybody thinks that I have an oil well and a horse in my backyard anyway. So yeah, and that is not true.
Well, next time I'm coming to Beeville, I'm going to come see you.
Please do.
All right, buddy. Thank you so much for taking time to come on the show today and talking to everyone. It's much appreciated.
Yeah, thanks for having me, Howard.
All right, have a great day and stay safe.
You too. See you later.